So I want to exhaust every single avenue before I ruin someone's life. It's easy to go in there and say, I'm just shutting down everything. Show me the evidence, hard, concrete evidence.
You know, there was this phrase we used to hear a whole lot about in Canadian public policy discussions. It was called evidence-based decision-making or evidence-based policy-making. The idea that you don't make a decision based on a whim, based on a hunch, based on an ideology, but based on, well, the facts, based on the data, the science, the evidence you had in front of you. Makes sense, right? And you would think it would make sense now more than ever when we're talking about the pandemic and we're talking about restrictions put on people's daily lives that could destroy their livelihoods. Well, what of it? Are we actually doing evidence-based decision-making when it comes to discussion of restrictions? What businesses and activities can stay open? Which ones should face reduced capacity? What degree of reduced capacity? Which ones should be shut down permanently? Or at least temporarily until we get over this hurdle, although many of them unfortunately do decide to shut down permanently because they just can't make it work anymore. Well, a number of reporting and post-media papers have pointed out that there's actually a whole lot of stuff that we don't know. How many cases of coronavirus have been definitely linked back to people going to the gyms? Well, not many, hardly any. And yet we're being told we have to add in restrictions. What about indoor restaurants, indoor dining? Well, Dr. David Williams, Ontario's official, he said, well, actually, it's not so much the indoor dining, it's actually the staff after the restaurants who have closed, and then they go in the back room, they hang out together in close quarters, they take off the masks. That's where it's spreading. Oh, okay, well, if so, first of all, can we see the data? And second of all, let's talk about that a bit more, because that's obviously not customers out in the main dining hall. Well, regardless, we see one politician now stepping forward and saying enough is enough. Ontario Premier Doug Ford said he wants to see the highest standards of evidence now when he considers new restrictions and new lockdowns. All of this comes after Toronto's Chief Medical Officer, Dr. Eileen de Villa, she called for much more severe restrictions on Torontonians, including restricting you from leaving your homes unless you fulfill one of a few criteria, the 4 or 5 or 6 activities that they say, yes, you are allowed to leave your house for. Wowzers. Well, Doug Ford said, hold on a second. I want to exhaust all other avenues. I want to pursue all other options before I actually go and basically ruin people's lives. That's how he put it. And well, that's true. If you tell a small business you got to shut down indefinitely, you're ruining their business, you're ruining their lives. Do we have to take this seriously? Do we have to wear masks, practice physical distancing, follow those protocols? You bet we do. But we also have to take seriously how we assess these restrictions and basically the demands we put on our public officials to make sure that they actually make sense.